How to perform the tests in the residential series. Taylor's residential series employs the same high-quality chemistries used in the kits we make for industry professionals, such as service companies. As the kit names imply, our 3 progressively more sophisticated models allow homeowners the choice of testing for more water quality factors. To help determine the best residential kit to suit your testing needs, we recommend watching the demo videos, How to Choose the Taylor Kit That's Right for You, and OT versus DPD, What's the Difference? Both videos can be found on our website under the Product Info section. In this video, we will demonstrate the tests included in the iCare kit, which has the most capabilities. The chlorine test in the iCare uses the DPD method. We will also demonstrate a chlorine test using the OT method, which is available in the basic and troubleshooter kits only. The kit's label helps distinguish whether the orthotolidine or OT method is used to test for chlorine or the DPD method. A yellow label indicates OT, pink indicates DPD. If your kit uses the OT method, it will have yellow standards on the sanitizer test side of the comparator block. If the kit uses the DPD method, it will have pink standards. Both comparators have the exact same color standards on the pH test side of the block. The reagent caps are color-coded to match the instructions, making it easy for the tester to find his place. In this first demonstration, we will perform a test for sanitizer using DPD. DPD is able to distinguish between free and combined chlorine. Rinse and fill the chlorine-bromine cell to mark with water to be tested. Add 5 drops of DPD reagent number 1 and 5 drops of DPD reagent number 2. Cap and invert to mix. DPD reagents number 1 and number 2 have the ability to be selective in their response to chlorine and only react with free chlorine, yielding a pink color. Match color immediately with color standard and record results as parts per million free chlorine or total bromine. Next, add 5 drops of DPD reagent number 3. Cap and invert to mix. The addition of DPD number 3 yields a darker pink color if combined chlorine is present. Match color immediately and record as parts per million total chlorine. Subtract the free chlorine reading from the total chlorine and record as parts per million combined chlorine. The DPD test provides results for free and total chlorine. DPD also can be used in the same comparator block to test for the total bromine residual in the range 1 to 10 parts per million. The test for sanitizer in Taylor's K-1101 uses the same DPD method, but is scaled for people who keep their sanitizer in a lower range, such as those who use an ionization system as their primary sanitizer and chlorine as the secondary sanitizer. For comparison, we will now perform a test using OT. Remember, the OT test is not part of the iCare kit, but it is available in other kits in the residential series. Whereas DPD can distinguish between free and combined chlorine, OT can only test for total chlorine or bromine. Rinse and fill the chlorine-bromine cell to mark with the water to be tested. Add 5 drops of orthotolidine reagent. Cap and invert to mix. Match color with color standard and record as parts per million total chlorine or total bromine. Performing a pH test. Rinse and fill the pH cell to mark with water to be tested. Add 5 drops of pH indicator solution. tap and invert to mix. Match color with color standard and record as pH units. If sample color is between two values, the pH is an average of the two. Save the sample if the pH needs adjustment. Performing an acid demand test. Demand tests are an easy way to tell how much chemical treatment is needed to bring the pH back into range. The number of drops used in the test can be translated into a treatment chemical dosage on the charts provided with the kits. Depending on the kit you buy, these charts can look like this or like this. If your pH is above the recommended range, do the acid demand test to determine how to lower it. Using the treated sample from the pH test, add acid demand reagent dropwise. After each drop, count, mix, and compare color with the color standards until the desired pH is matched. Performing a base demand test. If your pH is below the recommended range, do the base demand test to determine how to raise it. Using the treated sample from the pH test, add the base demand reagent dropwise. After each drop, count, mix, and compare color with the color standards until desired pH is matched. Performing a total alkalinity test. Rinse and fill the sample tube to the 25 milliliter mark with the water to be tested. Add 2 drops of thiosulfate N/10. Swirl to mix. Add 5 drops of total alkalinity indicator. Swirl to mix. The sample should turn green. Next, add sulfuric acid dropwise. After each drop, count and swirl to mix until the color changes from green to red. Multiply number of drops of sulfuric acid used by 10 and record as parts per million total alkalinity as calcium carbonate. Depending on the kit you buy, the treatment dosage charts can look like this or like this. Performing a calcium hardness test. The results of this test are for calcium hardness. Knowing the calcium hardness level of the water is even better than knowing the total hardness level the test strips give, because it's the calcium hardness portion of total hardness that really affects whether the water is trending towards scaling conditions or corrosive conditions. Rinse and fill the sample tube to the 25 milliliter mark with the water to be tested. Add 20 drops of calcium buffer. Swirl to mix. Add 5 drops of calcium indicator liquid. Swirl to mix. If calcium hardness is present, the sample will turn red. Add hardness reagent dropwise. After each drop, count and swirl to mix until the color changes from red to blue. Note: if you see any pink floating particles in the blue solution, disregard these. They are caused by magnesium hardness in the water. Multiply drops of hardness reagent used by 10 and record as parts per million calcium hardness as calcium carbonate. The treatment dosage chart for raising calcium hardness is located in the back of the I Never Liked Chemistry booklet included with the eye care kit. The only way to lower calcium hardness is to drain off some water and replace it with water of a lower hardness value. See your pool supplies dealer for specific advice about this. Performing a cyanuric acid test. When added to outdoor pools and spas, cyanuric acid, CYA, protects hypochlorous acid from the UV light that causes the sanitizer to rapidly decompose. An ideal concentration of 30 parts per million CYA will allow the sanitizer to last 3 to 5 times longer under sunny conditions. The CYA test is the test where most people have trouble seeing the endpoint where the reading is made. Here's how the progression should look when you hold the view tube at about waist height. Rinse and fill the CYA dispensing bottle to the 7 milliliter mark with the water to be tested. Add cyanuric acid reagent to the 14 milliliter mark. Cap and mix for 30 seconds. Slowly transfer the cloudy solution to the CYA view tube, number 9197, until the black dot on the bottom just disappears when viewed from the top. Read tube at liquid level and record as parts per million cyanuric acid. The ideal ranges for each of these parameters, as recommended by pool industry experts, are given in the test kit. Consult the experts at your favorite pool supply specialty store when test results indicate the water needs treatment. We really recommend homeowners read the I Never Liked Chemistry booklet because its illustrations and simple vocabulary make a complex subject approachable for the average person. This little booklet comes with the eye care kit, but it can also be purchased separately from your Taylor dealer. Benefits of using test kits with liquid reagents. Proven chemistries based on standard methods for the examination of water and wastewater. Liquid reagents dispense completely and eliminate the need to wait for tablets to dissolve. Drop tests are more accurate than test strips. Bottle caps are color-coded to instructions to help prevent mishaps. Dropper bottles dispense the exact amount of reagent needed. Drop tests require minimum technique. Tests can be performed in only a minute or two. Drop tests use a clear color change to signal the endpoint of the reaction.
Visit TaylorTechnologies.com to learn more about testing and treating pool and spa water. A water analysis calculator is available to testers using the eye care kit.